In the technical vocabulary of medicine, a stent is a mesh tube inserted into a natural passage conduit in the body to prevent or counteract a disease-induced, localized flow constriction. The term may also refer to a tube used to temporarily hold such a natural conduit open to allow access for surgery. Etymology: the origin of the word stent remains unsettled. The verb form stenting was used for centuries to describe the process of stiffening garments, and some believe this to be the origin. According to the Merriam-Webster Third New International Dictionary, the noun evolved from the Middle English verb stenten, shortened from extenton, meaning to stretch, which in turn came from Latin extentus, past participle of extendere, to stretch out. Others attribute the noun stent to Jan F. Esseur, a Dutch plastic surgeon who in 1916 used the word to describe a dental impression compound invented in 1856 by the English dentist Charles Stent, whom Esseur employed to craft a form for facial reconstruction. The full account is described in the Journal of the History of Dentistry. According to the author, from the use of stents compound as a support for facial tissues evolved the use of a stent to hold open various bodily structures. The first stents used in medical practice in 1986 by Ulrich Sigwart and Lausanne were initially called wall stents. Julio Palmas et al. Created a balloon expandable stent that is currently used. Invention: though many doctors have created the stent, the first FDA-approved stent was invented by Gary S. Rubin. Stent types: overuse. In 2007 the New England Journal of Medicine published the results of a trial called Courage. The trial gave recommendations about the practice of stenting in PCI, a heart intervention. This study was recognized as strong evidence for the need for a field-wide change in practice. Medical societies recommend that surgeons not perform stenting in the usual surgery of otherwise healthy individuals during percutaneous coronary intervention. A report by the Chicago Tribune also noted that the use of cardiac coronary artery stents was too high in cases where the patient was in at least stable condition and the coronary artery stent, was implanted on an elective basis. Many times more than one is implanted in the same procedure, even in the same vessel. However, the report was careful to note that they are indisputably still a viable therapy that often produces satisfactory results for those with acute coronary artery disease, such as relief of an arterial occlusion that has caused a heart attack, or where there is a danger of a piece of the blockage detaching and traveling to occlude a vessel in the cardiopulmonary system or the brain. See also: angioplasty, bronchoscopy, colonoscopy, esophagogastroduodenoscopy, grommet, interventional radiology, restenosis, bioresorbable stents. References. External links: coronary stent, drug-eluting stents, angioplasty.org, Cardiovascular and Interventional Radiological Society of Europe, the Cardiovascular Forum, Stent for Life Initiative.